made from that yarn only.
Though a prolific writer, but he was frugal with the usage of paper and would make sure to use it till its last bit.
While in Delhi, Gandhiji used to often stay at Chandiwala's Haveli at Katra Khushhal Rai.
He was also there in 1924, where he observed his 21-day long fast for communal harmony.
During the 1930s, Brij Kishanji helped organize the stone breakers of Delhi into a union, took up cases of violation of their rights with the Delhi administrators and in courts of law to ensure better compliance of government regulations regarding their work and to get compensation for them. Though he was asked by Bapu not to participate in Salt March in 1930, but he quit eating sugar and salt after that and did not do so for more than 50 years until mandated by his doctors. Brij Kishanji was with Gandhiji on the day of his assassination, and it was he who prepared Gandhiji's body for cremation.
Author in Hindi was titled Bapu ke Chandon mein, which was later translated into English as At the Feet of Bapu.
He was affectionately called as Bhaiji by his associates. Taking the responsibility of providing human service in education, post-independence, Brij Kishanji founded Shri Banarsidas Chandiwala Seva Smarak Trust Society in 1952 in the memory of his father.
Hello. What is that? Yes, please. अब अब देखो
Shri Banarsidas Chandiwala. Shri Banarsidas Chandiwala Seva Smarak Trust Society. Shri Banarsidas Chandiwala Seva Smarak Trust Society was founded by Shri Brij Kishan Chandiwala ji, who was a freedom fighter and a close associate of Mahatma Gandhi.
Brij Kishanji was born in the year 1900 in a highly regarded Chandiwala family who were silver traders in Chandi Chowk in Delhi.
He was educated at St. Stephen's College, Delhi, where he happened to meet Bapu for the first time in 1918.
His meeting with God deeply influenced British and he became his ardent follower and close associate. Krishnaji took to meager meals and to wearing khadi under Gandhiji's influence. He would not use any mattress but would sleep on rugs. He used to spin khadi on spinning wheel and to wear clothes made from that yarn only.
Though a prolific writer, but he was frugal with the usage of paper and would make sure to use it till its last bit.
While in Delhi, Gandhiji used to often stay at Chandiwala's Bailey at Karna Pushpal Rai.
He was also there in 1924, where he observed his 21-day long fast for communal harmony.
During the 1930s, Krishnaji helped organize the stone breakers of Delhi into a union, took up cases of violation of their rights with the Delhi administrators, and in courts of law to ensure better compliance of government regulations regarding their work and to get compensation for it. Though he was asked by Bapu not to participate in Salt March in 1930, but he quit eating sugar and salt after that and did not do so for more than 50 years until mandated by his doctors. Krishnaji was with Gandhiji on the day of his assassination, and it was he who prepared Gandhiji's body for cremation.
Krishnji's devotion for Bapu had no bounds. He authored a 3-volume book, Gandhiji Ki Delhi Diary, which chronicles Gandhi's day in Delhi. The other notable book that he authored in Hindi was titled Bapu Ke Chandon Mein, which was later translated into English as At the Feet of Bapu.
He was affectionately called as Maiji by his associates. Taking the responsibility of providing human service in education, post-independence, Krishnaji founded Sri Banarsidas Chandiwala Seva Smarak Trust Society in 1952 in the memory of his father, late Sri Banarsidas Chandiwala.
Post-independence, women education was a big challenge and of utmost significance. And Sri Krishnji addressed this issue by setting up Janki Devi Memorial College in the memory of his mother, Srimati Janki Devi ji. It was started in barracks at Rouse Avenue and was inaugurated by Mrs. Indira Gandhi in 1959.
The foundation stone for the present building was laid at an off-plot campus site in central Delhi at Sir Gangaram Hospital to cater Central and West Delhi population by Pandit Jawaharlal Nehru in 1960. This followed by laying of the foundation stone for the residential quarters by the 4th President of India, Sri B.D. Giri.
Janki Devi Memorial College is one of the prominent seats of women education in Delhi and is an autonomous institution affiliated to Delhi University.
The other educational institute for girls run by the trust is Janki Devi Vocational Center that equips the girls with vocational skills and paves the way towards their economic independence. Krishnaji was honored with Padma Shri in 1963 for his devotion and contributions in the field of social services. Sri Banarsidas Chandiwala Seva Smarak Trust Society runs 4 professional colleges affiliated to Guru Gobind Singh Indraprastha University. Banarsidas Chandiwala Institute of Physiotherapy is approved by Delhi Council of Physiotherapy and Occupational Therapy, Government of NCT Delhi, and is categorized as Grade A plus by SNRC. Banarsidas Chandiwala Institute of Information Technology and Banarsidas Chandiwala Institute of Professional Studies, Warka, are both AICTE approved institutes also and categorized as Grade A plus and Grade A by SFRC respectively. Banarsidas Chandiwala Institute of Hotel Management and Catering Technology. It is an AICTE approved and NAC accredited institute and also categorized as Grade A plus by SFRC. Furthering the other mission, health, the Trust Society is running multi-specialty hospitals, dispensaries, and healthcare centers and offering varied services through Banarsidas Chandiwala Institute of Medical Sciences and Eye Hospital at Kalkaji, New Delhi. Banarsidas Chandiwala Eye and Dental Care Center, Jammu Masjid. And Banarsidas Chandiwala Eye Hospital in Motihari, Bihar. Banarsidas Chandiwala famous mindfulness.
अरे नहीं ना एक और है एक और है
Chandiwala Institute of Physiotherapy runs a 4.5-year Bachelor in Physiotherapy program. BCIT is situated at hardly 200 meters walking distance from Govind Metro Station. In this study-free campus of the institute, the academic area comprises of state-of-the-art infrastructure. The classrooms of PCIT are well ventilated, spacious, and air-conditioned, equipped with all modern facilities and audio-visual aids. The exercise therapy lab has various gadgets like shoulder wheel, finger ladder, wall bar, parallel bar, suspension apparatus, Swiss balls, TheraBand and TheraTubes, bobble poles, and many others. The electrotherapy lab has various equipments like shortwave diatherapy, ultrasound, mechanical traction, multi-stimulators, paraffin wax spark, hydrocolloid packs, infrared lamp, ultraviolet lamp, and many more modalities for students to practice. The biomechanics lab is a specialized research lab with its unique aid and motion analysis system, EMG biofeedback unit, and other facilities. Manual lab promotes basic infrastructure for assessment and conduction of manipulation and mobilization techniques for joint and soft tissues. The research lab. It is also designed to facilitate appropriate environment and equipped with latest modalities and tools to carry out research activities with EMG biofeedback and evoke potential unit, electronic pen and maze for sensory integration, dynamometer to measure muscle strength, vestibular rehabilitation aids, and hand re-education tools. The physiology lab is well equipped to conduct practicals on hematology, respiratory system, cardiovascular system, and nervous system. Anatomy lab provides the students with state-of-the-art models, charts, skeleton, and specimen to practice the minute details of anatomy. This lab has an ample number of boards for the students to observe and practice. The lab is also having an anatomy museum of human body parts. PCIT has a Wi-Fi enabled campus and computer lab with dedicated leash time. Event utilization facilitates the students for their curriculum and projects.
The Physiotherapy Clinic, run by the Institute, has various assessment, diagnostic, and treatment modalities for the patients. The modern equipment for fitness, fat analysis, lung function testing, digital balance assessment, and various others for pain management and rehabilitation makes us one of the best training centers for the physiotherapy students. The primary repository of learning and knowledge at PCIP is the library with over 3,000 books on physiotherapy, medical subjects, and related areas, besides a large collection of newspapers, magazines, national and international periodicals, and journals. PCIP also has a modern auditorium for students' all-round development in different aspects. There is an in-campus canteen, an area for relaxation and rejoicing for the students. Campus also has hospital facility and health services. Hostel facility is also available for both. The Banarsidas Chandiwala Seva Smarak Society was founded by Sri Krishna Chandiwala ji, who was a freedom fighter and a close associate of Mahatma Gandhi. Rich Krishanji was born in the year 1920 in a highly regarded Chandiwala family, who were silver traders in Chandni Chowk in Delhi. He was educated at St. Stephen's College, Delhi, where he happened to meet Bapu for the first time in 1918. His meeting with Bapu deeply influenced Krishanji, and he became his ardent follower and close associate. Rich Krishanji took to meager meals and to wearing khadi under Gandhiji's influence. He would not use any mattress, but would sleep on rugs. He used to spin khadi on spinning wheel and would wear clothes made from that yarn only. Though a prolific writer, but he was frugal with the usage of paper and would make sure to use it till its last breath. While in Delhi, Gandhiji used to often stay at Chandiwala's Bailey at Katra Pushpal Rai. He was also there in 1924, where he observed his 21-day long fast for communal harmony. During the 1930s, Rich Krishanji helped organize the stone breakers of Delhi into a union, took up cases of violation of their rights with the Delhi administrators, and in courts of law to ensure better compliance of government regulations regarding their work and to get compensation for them. Though he was asked by Bapu not to participate in Salt March in 1930, but he quit eating sugar and salt after that and did not do so for more than 50 years until mandated by his doctors. Rich Krishanji was with Gandhiji on the day of his assassination, and it was he who prepared Gandhiji's body for cremation. Rich Krishanji's devotion for Bapu had no bounds. He authored a three-volume book, Gandhiji Ki Delhi Diary, which chronicles Gandhi's day in Delhi. The other notable book that he authored in Hindi was titled Bapu Ke Chandiwala, which was later translated into English as At the Feet of Bapu. He was affectionately called as Elijah by his associates. Taking the responsibility of providing human service in education, post-independence, Rich Krishanji founded Sri Banarsidas Chandiwala Seva Smarak Trust Society in 1952 in memory of his father, late Sri Banarsidas Chandiwala. whose independence, women education was a big challenge and of utmost significance. And Shri Brish Krishanji addressed this issue by setting up Janki Devi Memorial College in the memory of his mother, Srimati Janki Devi Ji. It was started in barracks at Rouse Avenue and was inaugurated by Mrs. Indira Gandhi in 1959.
The foundation stone for the present building was laid at an off-block campus site in central Delhi at Sir Dalaram Hospital Mount, to cater central and west Delhi population by Pandit Jawaharlal Nehru in 1960. This followed by laying of the foundation stone for the residential quarters by the fourth President of India, Shri B.D. Giri.
Janki Devi Memorial College is one of the prominent seats for women education in Delhi and is an autonomous institution affiliated to Delhi University.
The other educational institute for girls, run by the trust, is Janki Devi Vocational Center that equips the girls with vocational skills and paves the way towards their economic independence. Rich Vishenji was honored with Padma Shri in 19.
पोस्टर लगा दूं मैम पोस्टर लगा दूं बस गलती नहीं होनी चाहिए ना आज गलती नहीं होनी चाहिए तो सॉरी सर से लगा दूं यार गलती हुई पोस्टर तो हिमानी आदित्य शुद्धि इनका क्वेश्चन है
हिमानी
यार आदित्य हाँ वो आ गया
हेलो Good morning to one and all present here. On behalf of Banarsidas Chandiwala Institute of Physiotherapy, I, Khushi Rawat, extend a warm welcome to our respected Director Sir, faculty members, our esteemed guests, and all my fellow students. Today's seminar is centered around a theme that lies at the heart of every healthcare profession, evolving as a healer, a neurosurgeon's perspective. To carry the program forward, I would now like to warmly welcome our esteemed guests, Dr. Rana Father Sir, Dr. A.P. Tomar Sir, and Mrs. Pavna Ranganathan Ma'am. Sir and Ma'am, I humbly request you to please come on the stage. I also request our respected Director Sir to kindly join us on stage. Please give them a huge round of applause, everyone. Before we begin the session, I would like to invite the Director Sir and our esteemed guest for the lamplighting ceremony, a symbol of knowledge, purity, and enlightenment. May this light guide us towards wisdom and inspire us throughout today's session. Sir, I request you to please forward for the lamplighting. I would also like to invite Sneha from second year BPT to come forward and present the shloka. Please give her a huge round of applause, everyone.
शुभं करोति कल्याणम् आरोग्यं धनसम्पदा शत्रुबुद्धिविनाशाय दीपकाय नमोऽस्तुते दीपो ज्योति परं ब्रह्म दीपो ज्योति जनार्दनः दीपो हरतु मे पापं संध्या दीप नमोऽस्तुते शुभं करोति कल्याणम् आरोग्यं धनसम्पदा शत्रुबुद्धिविनाशाय दीपकाय नमोऽस्तुते दीपो ज्योति परं ब्रह्म दीपो ज्योति जनार्दनः दीपो हरतु मे पापं संध्या दीपं नमोऽस्तुते
Thank you, sir. Thank you, Sneha. In the medical field, healing is not just the skill. It is a continuous journey of growth where science meets compassion, discipline meets empathy, and knowledge evolves with every patient we encounter. Through this topic, we aim to understand how a healer is shaped not only by expertise but also by experience, resilience, and the will to serve humanity. And to guide us through this profound perspective, we are honored to have with us one of the nation's most respected names in neurosurgery. Before we proceed further, I would like to invite our esteemed director, Dr. C.S. Ramsar, to share a few words and formally begin the session.
Thank you, Kushi. It's indeed a warm welcome to all the guests here. We have with us Dr. Rana Pate sir, neurosurgeon from Fortis Hospital, Mrs. Pavana Ranganathan, Mr. Ranganathan, who have been instrumental in arranging this program. We have with us Mr. V. Srinivasan, who is the regional facilitator for Heartfulness in Delhi NCR, and all the faculty members, students, and members from the staff. The purpose of this seminar is to bridge the gap in the learning of a physiotherapist. The gap is that he or she is not able to see the surgeries, but at the same time, he wants to know what happens and what is the thought process of a surgeon, what is the surgeon's perspective when he or she performs the surgery. What will be the functional outcomes? What will be the rehabilitation goals that have to be set? And how, from a surgeon's point of view, the patient's recovery should take place. And I am indeed glad that we have with us Dr. Rana Pate, who is an eminent surgeon, a person who has performed so many surgeries. He is also guiding a team of physiotherapists. So it is really a pleasure for us, and on behalf of Banarsidas Chandiwala Institute of Physiotherapy and the entire management, we would like to welcome him. Thank you so much.
Thank you so much, sir. Now, it is my privilege to introduce our esteemed guest for the day, Dr. Rana Pate, MS, MCH, and Fellowship in Neurosurgery. Dr. Pate is one of the India's most eminent neurosurgeons with over 32 years of experience in advanced neurosurgery. He currently serves as the chairman, Department of Neurosurgery at Fortis Memorial Research Institute, Gurugram. He has been part of the teaching faculty at the AIIMS and Sir Ganga Ram Hospital, New Delhi, and also served as the professor of neurology at Guwahati Medical College. Dr. Pate specializes in minimally invasive brain and spine surgery, skull-base surgery, neurovascular surgery, ECIS, IC bypass procedures, pediatrics neurosurgery, and epilepsy surgery. With more than 10,000 neurological procedures to his credit, his contribution to the field is truly inspiring. We are deeply honored to have you with us today, sir. Thank you for taking out time to guide us. Now, please welcome him with a round of applause.
Videos are coming.
Yes, sir.
It's coming. The videos are coming.
Videos are coming, but not the sound.
No, there's no sound. There's no
Then
sound.
the videos are coming.
I think I'll send the videos. Okay.
We can do this.
No, that's good. I mean, I'm okay with this. Yeah. Yeah. Yeah, it's great to see young people all geared for the learning process of becoming a healer. I chose this topic because, I thought I was trying to find out what is common between my audience and myself, and that is we are both healers. It's a never-ending process of learning how to heal, and it's not about techniques, it's all about connecting with people. And this is not really a talk about to lecture you about what you should be doing, but it is more about my own journey as a healer, what I learned over the years, and what are the things that has made me what I am today. So I hope you take it more as a message to, and hopefully use parts of it to build your own self as a healer. Next slide, please. So essentially it is based on two arms. One is professional competence, the other is self-development. Okay, so professional competence is something, as professionals, we cannot underdo that. We have to be competent. There's no question of it. And can I have the next slide?
Yes, sir.
Yeah. Okay. So what you all are going through right today is the foundation building. These are the building blocks on which your whole career will stand. This is an absolute essential in developing your professional competence. So this is something we have to take very seriously. Sometimes it can be very exciting, sometimes it may not be very exciting. But as you'll see, as you go along the path of becoming more and more competent, you will find that as a healer, these things become more and more relevant and therefore much more interesting and exciting. Certainly, previous slide, please. Yeah. So some of the things where you do is certification. That is another thing that you'll be doing. And so I would advise you that you shouldn't limit your learning to just this, to what you're doing, to just physiotherapy. Healing is a very broad-based subject, and whatever you do is going to finally help you sometime in your life. So it is not just what you're learning in physiotherapy. For example, if you have some hobbies, don't underestimate it. It will, see, these are the differentiators. These are the differentiators what will make you different from other people, your additional interests. So don't ever keep it away from yourself. Go into those as well, right? Widen your whole perspective. And of course, these things you have to keep on practicing. Whatever you learned, it is practice and practice and practice again, which makes you a master of your craft. So the other thing I'd like to expand on is competing with yourself and expanding beyond the basics. So can I have the next slide? So I think, next one, yeah. So there's this author who gave this quotation that competing externally, you compete with others. You're comparing yourself. What you need to do is that you compete internally, and that is what, that is what makes you improve upon yourself. So the whole idea of this is that every day you try to become a better person than you were the previous day. And this approach is important because if you compare yourself with others, then that leads to a lot of frustration, a lot of anxiety, because you may not be able to achieve what the other person is achieving. You're different from the other person. Your goals will be different, your strengths are different. So that is what you need to work on, your own, that you compete with yourself. So that is a drive which is more resilient, right? More sustainable, right? In the long term. Of course, you need to be careful that, in the process of being, competing with yourself, that you don't overdo and try to become a perfectionist and becoming too self-critical. And these are negative things. Next slide, please. As far as expanding beyond the basics, I've already delved slightly on this, and that is develop other interests, right? And so once you've gone through the process of developing your basic foundations, you're now able to grow beyond that, right? And so personally, when I started as a surgeon, learning about different techniques, I spent a fair amount of my life doing routine operations, right? And developing the experience and the confidence to do those. For a surgeon, it takes, I would think, at least 5 years, and for a neurosurgeon, probably around 10 years, to go beyond your things that you've learned and experiment, and starting to experiment on things which you haven't learned, right? Which you may have read about, or which you're thinking very creatively and doing differently. So as a healer, those processes are extremely important. You cannot be stuck into what you've learned. You have to go beyond that, right? And in all this, it's that creativity. I mean, you would think that how can a doctor be creative? Yes, you can be. It is important to be creative. It is important to innovate, because that is what makes you different from others. You need these differentiators to be the person who really stands out, right? So this is the process. Like I've already delved in it. Other interests, whatever interest that you have, don't keep it hiding. Bring it out, work on it. These all help in finally making you what you are. Next slide, please. So I'll just go through some of the medical stuff that I've done over the years, and I will focus on one aspect which is close to my heart, which is minimal invasive surgery. And this aspect, this particular talk will be focused on how I use a tube, right? So it's a very simple device. And so tube is basically a working channel through which you can reach various parts of the body or the spine. And it's a very simple tool. And so you can see this first slide is, do I have a thing? Pointer? No, okay. So anyway, you can see this right in the center, this round thing, right? So that is a patient who had this, what's called a colloid cyst, right? So it is a cyst sitting right in the middle of the pathway of the fluid. So all that white stuff is water, right? And this is a reasonably normal looking brain, except that you have this cyst in the center, and that is cause obstruction to the fluid pathways, and there is some ballooning of the fluid pathways. So as you can see, it is right in the center, and you think, how do you remove it, right? So there are various ways of doing it, and one of the things, methods of removing it was by open surgery. You go in between the two hemispheres and reach the center. Now, majority of people won't do it that way because there is a certain amount of risk related to that. There is the risk to life is significantly much higher than all the minimal invasive approach. So the other approach that people have been doing is doing it endoscopically, right? So endoscope is I'm sure you must be familiar with it. It's basically a tube with optics in it and a narrow tube through which you can visualize, and if you have a camera at the end, you can see all that in a video. The problem with endoscopes in this setting is that you're working through a channel, right, where you can only use one instrument, right? So you can understand this cyst is actually like a balloon floating in water, right? So if you can imagine a balloon with, let's say, which is full of water, in a tub of water. If you try to cut it, you can't, because each time you use a scissor on it, it runs away, right? It floats away. So you need to have two instruments. So we progressed into, so that was the thing that I started doing. We went into a slightly larger tube where we could use conventional instruments. Next slide, please. So this is a picture of a similar patient, and when the fluid spaces are very small, we use something called image guidance, where you use the digital data of the MRI to precisely reach there. I'll show you that equipment later on once we come to that picture. So with that, we are precisely able to go to this area. And so this low part shows a trocar, and essentially this trocar held a 5 ml syringe, right? So the working channel is actually a 5 ml syringe, so which I tell patients is the size of my little finger, right? So that is our working channel, okay? Next slide, please. Can you have the video? So this shows the choroid cyst, and you can see I'm using a bipolar forceps. We are cauterizing the choroid plexus, and we have a suction on the left hand. And you can see we are using a scissor to dissect all the vascular connections to this. This is, of course, high speed, so this is not the speed that I operate. It is, I think, at least 3-4 times the normal speed. And that is out. See? So we could now use conventional surgical tools, that means scissors, suctions, bipolars, right? And could achieve the same target much more effectively, much more safely, right? And it is so important in these patients to have a complete removal. You can understand if you are just having one tool, how much more this would have, compromised the whole target, right? Next slide, please. So here's a picture before and after operation. You can see in the center picture, in the lower one, a small dot somewhere in the front on the right side, right? So that is the scar of the operation. It's a tiny, very tiny opening, right? So that is how we can achieve a very minimalistic way of achieving a target. So we not only operate on these small things, we can operate on big things as well. Next slide, please. So here you can see it's a huge tumor right in the center. It's right in the middle of that fluid cavity. It's occupying the whole space. And it's the same principle. We use a tube. Now, because of the complexity of this, it is much larger, it is very vascular, there's a lot of blood in these structures, you can have a lot of bleeding. So we need to use special forceps which can stop all the bleeding. And because the forceps are much bigger than the usual, we use now a tube which is the size, again I explained, the size of my finger, my index finger, right? So, so it's a very nice way of removing such large tumors. We could achieve a complete removal in this case. You can see the trajectory of our surgery. Next slide, please. And here's another case, also very large, and that's the post-operative picture below. Next slide, please. This is something, so the previous cases were something called neurocytomas. These are actually benign conditions in the majority, and if you can remove it completely, it is actually a cure. So it is so important to be able to achieve these ends, and this is a very effective way of achieving the ends in this thing. This is a benign tumor, it's a meningioma, which is in the fluid space, and similarly, we were able to remove it completely by using a tube. Next slide, please. So all these tumors were within the fluid space. We can also do the same thing within the brain substance. So this is a tumor which is in the brain substance. This is actually something called a glioblastoma. It's a grade 4 cancer, glial tumor. And so since most of you are familiar with anatomy, this is very close to the motor strip, right? The leg area is just here. In fact, patient came with difficulty in walking, right? She was walking, but she had a difficulty. So the constraints when we were operating was that we wanted to save the leg area. So that is the design of the surgical tract. You can see on the left corner, the tract. So that is coming from the front. So you're avoiding the motor strip, you're avoiding the corticospinal tracts, and achieving a near total removal. So near total removal, this is a malignancy, but near total removal is extremely important to achieve the long-term goals, right? So, so I routinely do an MRI in all of my patients with malignancies following surgery. I would like to point out that specifically. See, it's not necessary to do that, right? But it's something which is the most important variable in the treatment, which determines outcome. So it's now nice to know how much you have removed. It also pushes you, because you are going to do this test the next day in the morning. So it pushes you to be more complete. So you're enhancing you're setting a target for yourself. It's very important to set targets, right? And to achieve those targets. You shouldn't be afraid of this. If I were afraid of achieving my target, I would have done MRI scans the next morning. So this is how you push yourself. This is one way of pushing yourself. Next slide, please. Yeah. So this is a tool I had made by myself. So I started endoscopic work. So this is an endoscopic tool which I had designed many years ago. I don't really use it now, but I had used it when I didn't have any tools, right? And I certainly wanted to do endoscopic work. So I made it. So you can see the working channel, which is on top, the cylinder, and then you can see, how would I say, something which goes around the cylinder, and you can, the picture on the left is something called a Lila retractor, which can hold the tube in whatever position you want to. And on the right-hand side, lower part of the picture, that evolved from a paper clip, right? So the first time I literally used this device was, I fashioned a paper clip to do this work. So this is how it works. Next slide. So if you look at the paper clip now, is the upper left-hand upper part shows the paper clip. This is the top view, right? This is the top view of your cylinder. Bottom of that is the lower end view, right? So you have these two, the paper clip, the two ends of the paper clip. Finally, of course, it's not a paper clip that I use. I use fashioned a K-wire to do the same function. So it's K-wire is a stainless steel bit of wire which you shape. On the right-hand side is just to see what it looks like is the endoscope, right? So the size that I used was a 2.7 millimeters. So these are generally available in all operation theaters. You use it for pediatric cases, and so the way this works is, if you look at the center lower picture, so you see the telescope. So you have the whole cylinder with the working channel. You have the telescope on top, and so your tool is below. And because of the paper clip, what that does is it prevents scissoring. So if you have two tubes, two instruments in a tube, you can't really control both the instruments because in the end of the tube there'll be scissoring. It will go here and there. Because of this guidance system, which is just a paper clip, it worked very well. That's what I mean. I mean, you can be creative. You can do things. It can be very simple. And it worked very well. I've done at least 50, 60 cases endoscopically. You can, basically this is for doing very simple endoscopic procedures in fluid-filled spaces. And the most common thing is where you open membranes, right? So there is a procedure called third ventriculostomy, where there's an obstruction of the aqueduct, right? And that can lead to hydrocephalus. And what you do is you make a small hole in the floor of the third ventricle, wherein you open straight into the subarachnoid. So this is a great tool for doing that procedure. Next slide, please. Now going into the lumbar spine, here also I've used tubes for treating a lot of conditions. The most common lumbar spine disease that we treat is for slip discs and lumbar canal stenosis. Yeah, I'm sure you must be all familiar with this. You treat a different aspect, I treat a different aspect of it. And so the whole basis of using a tube is most of the times these pathologies are very limited in terms of distance, right? So you can see the picture on the left-hand side. So in the longitudinal extent, it is maybe 10, 15 millimeters. And if you look at the axial sections, that shows a canal stenosis, wherein you have very oversized facet joints and a very thick ligamentum, which is making that internal space very small, right? So when you put in a tube over it, it's like, because it's a tube, you can change the angle, right? And what you see in front is what you can remove, right? So this is the technique, this is the basis of doing these procedures. Next slide, please. So this is a typical picture of this, the setup. So you have this arm which is holding this tube in place, right? Next slide, please. So again, I didn't have these tubes, right? And these during my, once I'd gone into practice, we didn't have these tubes, and I didn't want to wait for the hospital to require it, so I made my own. And the way I did it was, I went to Chowri Bazaar, bought a stainless steel tube, right? And lots of copper tubes. So Tori Bazaar, you should go sometime. It's a wonderful place to see all sorts of things. So basically you had copper tubes of different sizes which fitted into each other, and then you can actually hammer the tips a bit, and so that you can mold it so that it conforms. So you actually have a set of tubes which can gradually open the space through muscle and finally put in the working channel. Next slide, please. So this is a pre-op and post-op picture of a treatment of a canal stenosis. You can see it is fairly wide, and so by doing this procedure, we are not really compromising all the endpoints. You are actually, because you can enter these structures at much steeper angles, at whatever angle you want, your decompression of these canal stenosis is much better. So that is always important. Whatever you do, at least in medicine, as a healer, whatever you do, you cannot compromise on the end result. And certainly this technique does not compromise on the end result. Next slide, please. Okay, so after this, then you evolve, right? You push yourself, push your, what you can do with yourself, and go to the next level. Challenge yourself, go to the next. This is all about, pushing yourself and driving your own self. And so now we have a technique where we can widen the canal. So we don't have to do a laminectomy, right? So now we have a working space where we see the dura, the spine, and now we can go ahead and remove tumors as well. So this is a picture of a tumor on the left upper end. You can see there's a tumor. The white thing is the tumor, and the spinal cord is behind it. So, right? So what is the constraint here? Constraint is you cannot touch the spinal cord, right? So if you're going to touch the spinal cord, you're going to retract it, the patient's going to get paralyzed. So you have to remove that tumor without doing that. So how do you do that? So but the conventional teaching is to go from the midline, do a laminectomy and remove it, right? So the whole problem with that is that spinal cord is right in front of you. So what you do differently, it's basically just a very basic thing. You come in from the side, come in from one side. So quite frequently these tumors have a certain amount of laterality, slightly to one side. So you go from that side. Okay, so this is one of the earlier cases. So I use this tube which is called a quadrant. It is basically a tube, but it has 4 leaves which you can expand, and that's why it's called a quadrant. And so your exposure is slightly bigger, in the lower end of the wound. Okay, so this is the left lower end is of a picture of the exposure and how it works. So it's a window that we make on the lamina, and we're coming in from one side. You can see the spinous process all intact. So the beauty is now we have kept the spine intact as well. We are not removing the spinous process. We are not removing the interspinous ligaments. Structurally, we are respecting the human body, right? And let's have the video of this. Next slide, please. Just start the video. So this is after doing the bone work. Oh, you have to go back here. क्या चालू नहीं हो रहा है? No. So you're cutting the dura. So you just need to make a slight thing, and once you enter that, just with the suction, we can open up the whole dura. It opens up. You're doing it along the fibers. Then so you can see the spinal cord is, on the upper end, and the tumor is in the lower end. And basically you're using a tool which is called an ultrasonic aspirator, where you are internally collapsing the tumor, right? So this instrument, it's basically an acoustic horn where the tips are vibrating at a very high speed, and this disintegrates the tumor, and if there's a suction, it sucks it out. And once we do that, then you can see now, what we can see here is the anterior surface of the spinal cord, right? So the whole tumor has now pushed the spinal cord to one side. And once that tumor is out, we can see the whole anterior surface. This is not possible with conventional surgery. Next slide, please. So this is something called an arachnoid cyst, right? This is the arachnoid. Again, you must be familiar with all these. Today I was quite surprised to see how extensive your your basics are, that you go through the same things that I went through as a medical student, anatomy, physiology, biochemistry, all those things. So this is exactly what we did. And so arachnoid is the pathway through which the fluid passes. And sometimes the cysts form like this when you have an entrance into that space, but no exit. So it collects, right? So this is a picture of an arachnoid cyst. And after we remove the cyst, the picture on the extreme right is of the cyst out. And we have a fairly normal looking spine. So how is this done? So in this particular case, this case was a patient who had this cyst in the dorsal spine, right? And because of the rib cage, the dorsal spine is slightly different from other places. We can actually go through the joints, right, without destabilizing it. And so we can come in a very flat trajectory. This is all from posteriorly, right? So instead of making an incision in the midline, again, that is conventional practice. We would come in from an extreme angle. So we'll show this slide of the video of that. Next slide, please. So this is after the bone work is done, the dura is cut, and so so you can see so this, again, you're seeing the anterior surface of the spinal cord. So you're going from the posterior, but you're seeing the anterior surface. So one of the structures which hold the spinal cord to the same side is the dentate ligaments. So when you cut the dentate ligaments, these things literally flies off like a kite, it flies away from you. And then you see the spinal cord flies away from you. So you can see now the whole undersurface of the spinal cord. And the problem with this disease is that there's a very high incidence of recurrence, because most of the times you are unable to see the other end. But with this approach, we can reach right to the other end. We can see clearly. You can see here clearly. I don't know, have you understood this? That is the other end of the spinal cord, the opposite side. Because of that, you can see the whole extent of their arachnoid cyst, and you're able to exercise it totally. That brings a cure, right? Otherwise, it's a recurring problem of recurrence, and again, paraparesis and even paraplegia. Next slide, please. Yeah, this is a case where we did a lot of these minor procedures. You can see maybe how much, maybe five. Yeah, so we spend the whole day doing this. Again, you're pushing yourself, doing things, and setting your own targets. And so it's so important to do these. And these are not really, if you break it up, if you break up these operations, they're bits and pieces of the same thing, right? So what may seem very unachievable, as you do bits and pieces of it and think it like that, lots of things are possible. Next slide, please. So these are typical, well, not typical, I would say. We are quite blessed by having all the latest gadgets now. This is something called an O-arm. You can see on the right-hand side, it's like a C-arm, right? But it's beyond the C-arm, where you can actually do, you have CT scan-like quality of the spine. And we've also acquired a spine robot where we can precisely put in screws, right? So we use this gadget for doing all that. Next slide, please. So this is a layout of a typical operation, wherein you can see I'm there behind them, that thing over there in the center in the background is the microscope. There's the operating microscope. These are huge. They almost weigh a ton, I think. And the ton is mainly to hold the optics in a steady spot, right? And so almost, I think I would say 90-95% of my work is with the microscope, right? It's very rare that I would operate without a microscope. Okay, so the last couple of slides. So coming to the last bit is the development of your personal self, right? So as healers, we are always living with illness, right? With sickness, with people in suffering. So these things can be very negative to us. It can also be very uplifting, right? Because if you're able to heal, achieve those things. So we need to develop ourselves, right, to be able to stand all these stresses. And so that it becomes an important part of your arsenal in dealing with this life as a healer. Next slide, please. So when patients come to you, they come at the most vulnerable, right? So it is very important that you can't just be having sympathy, right? You have to go well beyond that. You have to have empathy. That means an understanding, not only at a cognitive level, which is understanding at a mental level, at a logical level what the suffering is, but also to a degree feel the emotions of the patient, right? And because that actually makes you a human being, right? And that also makes you, treat them as people. It is very easy to, especially almost all of us are trained in government institutions. So because of that, the work pressure, all these things, you can become very unfeeling. You're overwhelmed by the crowds and all that, and you can become very unfeeling. So it is important to learn these soft skills, right? And so beyond empathy, you have to now become compassionate. That means you have to be proactive. Here is a patient, let's say, who has come to you with suffering, right? Coming to you as a healer. So your job is to heal, but you also have to help that person face the risks of the treatment process, right? Especially for a surgeon, it becomes even more important, right? And you'll have the same things that you'll face in your life. So for that to happen, you have to be basically strong, emotionally strong, and you have to use methods wherein these factors are achieved, right? So all these attributes that you can see on this slide are attributes which actually is very enhanced by meditation. That is something which I around 25 years ago. And it's very difficult to quantitate how it has helped me. But I'm fairly sure that it must have. You see, there are a lot of times when we're doing procedures, we come across, like when I'm operating, sometimes you suddenly come across a crisis which could mean life and death, right? And when you come across those crises, really you're very alone. You're very alone because you are the only person there, right? As neurosurgeons, we actually operate very alone, right? We don't really have, we may have somebody assisting you, but you are the only person who's seeing and controlling things. So it's also very important to at least I don't know how much for you, but as a surgeon, it is very important for me to be slightly spiritual in the way I do my things, because it is only then that you ask for the strength to carry on and conduct yourself in the right way that you can save the life. Thank you very much.
Thank you, sir. So we'll move into the interactive segment of today's seminar. Any student, if have any questions or doubts, sir will be answering them and sharing his insights with us. So anyone have any doubt? Sir.
Yeah.
Good morning, sir.
Yeah.
Sir, what are the expectations of rehab team pre and post surgery?
Expectations of
Rehab team.
pain.
Rehabilitation team.
Okay, rehabilitation team. Okay. See, this. Well, it depends. It depends on what is the condition of the patient, right? And so a lot of our work is done in patients who are, otherwise pretty well. But again, yes, we have patients who are not too well. So the kind of input that's required for both is quite different. Most of the times, these are very short term in the hospital itself for a few days. But some of these patients need very long-term rehab programs. And right now, I think there are few hospitals which cater to that long-term programs, but they're actually they're not enough. They should probably be much more. So I think this is a place where there is a lot of potential. Like when you go abroad, right? You have regular big hospitals which are just doing rehab work, right? That is not so in this country, right? And I think there's still a huge potential for that. And well, I'm not. So far, whatever the centers that are available are quite small, right? And very few people. But yeah, potentially, I think there is a big thing. I think I'm not too sure how you see all these things tend to be going over several months, and so I'm not too sure how the insurance covers these things. I'm sure there's a lot of lack of maturity in that whole field, and I think it's going to evolve in the future. Yeah, there's a great need for it, certainly.
Thank you, sir. Good morning, sir.
Yeah.
Hello, good morning, sir. So my question is, according to your perspective, what are the three most measurable rehabilitation goals of the physiotherapy must achieve in first 30 days post-operation to ensure the long-term effect?
You want three, is it?
Yes, sir.
Well, okay. What I've seen is one of the things that physiotherapists are not very sensitive to is pain, right? I mean, post-operative pain. And it is different for different people depending on surgical procedure. And I think there is certainly a place where you can learn about it, you can be more sensitive about it, because unless we are dealing with pain properly, we cannot go to the next step, right? So a good pain control is very important, and a lot of times this pain settles on its own, right? So as a general principle, what I tell my patients, especially after painful operations, so most of the painful operations are in wherein there's a lot of muscle dissection. So basically, wherever there is movement, all structures which have movement. So surprising the skull, because there's no movement, is not very painful, right? But anything else, the spine, the abdomen, the chest, there's a lot of movement, so there can be a lot of pain. So as a general principle, the pain is maximum in the first 3 days. After that, it goes down drastically, right? So you need to be sensitive about that, and in a sense, the way you do rehab should be certainly modified in the first 3 days. Keep it very limited, and it's only expand after that, right? So I suppose that would be point one, right? Then again, all these things are, so most of the times, again, it is pain-based. So whatever you do has to be with the feedback of the patient, right? Feedback. So what I tell my patients is the most important factor which will determine what you do is whatever you do, don't elicit pain, right? So that is very paramount. So sometimes physiotherapists do get too enthusiastic and do it in a particular manner, right? Which can be too aggressive for the patient. So pain is a very good feedback mechanism to guide your, your therapy, right? And so one is that, and the other thing is, when you do escalate treatment, you should do it in a very progressive way. You shouldn't be too fast on it. So certainly when patients are back home, what I tell them is, stick to the same thing for at least a week. Start very small, start very slow. Stick to the same thing. Watch yourself, how you're doing. If you feel comfortable, then you escalate. So it is not a daily progression upwards. It is, I would say, weekly or even longer periods where you escalate the level of physiotherapy. I suppose that'll be number 2. Now I don't think of the third one. So I think 2 is enough.
Thank you, sir.
Yeah.
Good afternoon, sir.
Yeah.
My question is, in which type of surgery, brain or spine, does the minimal invasive surgeries clearly give the better long-term functions or results and fewer complications compared to the traditional techniques of surgeries?
Almost everywhere. Yeah, there's no difference. It is a body, the same mechanism of healing. So the more you traumatize it, the more longer it takes. So wherever you can, you try to be minimalistic. Absolutely. Yeah. And more techniques are available to achieve those targets in almost everything. Yeah.
Good morning, sir. So my question is, as a physiotherapist, we frequently manage patients with stroke and aneurysm. From a neurosurgical perspective, what are the key considerations, precautions, and goals you expect during rehabilitation process for these patients? And also, what rehabilitation milestones or red flag signs should we particularly keep in mind while planning physiotherapy?
Yeah. Yeah, so Well, see, these conditions that you just enumerated, they take a long time for recovery, right? And so the obvious thing is, if all is going well, there's no issue, right? And if you see a progressive improvement in the person's condition, there is no issue. But yeah, there are certain conditions where the disease may not stop at the initial level when patient was initially admitted to the hospital, but they've now come to you and you're treating and you're seeing that the patient is not doing so well. The patient may even be worsening, right? So it's important to be sensitive to that, right? So there are conditions which where there can be deterioration of the initial insult, right? So whenever you see such situations, be improving but is worsening, whether physically or mentally. So that is a point where you do need to, take the opinion of an appropriate consultant, probably the doctor who had initially referred the patient. Like so these are conditions like let's say aneurysm, let's say, right? So aneurysm, it's a subarachnoid hemorrhage where you have blood going all over the place, and it absorbs, and with that, so the initial generally 1 month or so is bad for the patient, and as the patient comes out, he can continue to improve. At some point can deteriorate, and the commonest cause for deterioration in these situations are one is electrolyte imbalance, so you need to be sensitive to that. Sometimes if the patient's conditions are very good, it can be sepsis. It can be something called hydrocephalus, wherein the arachnoid pathways may continue scarring, right, and obstruct the fluid pathways. So that can cause hydrocephalus. That can cause, again, a decrease in the alertness. It can affect the walking. It can affect continence. So these are the things that you need to be alert for. Yeah.
Thank you, sir.
Yeah.
Good afternoon, sir. My question is, what inspired you to become a neurosurgeon?
Yeah. Well, actually, if you look at it, my story is quite. Let's say I was, in a way, going with the wind, right? That means not really planning it, right? I went according to how life took me, right? For example, why did I become a doctor before becoming a neurosurgeon? Well, we were having a family get together, and my mother said, "Koi doctor nahi banaya, koi to bana." So I said, "Okay, I'll become a doctor," right? Literally. And in fact, in school, I'd dropped my biology, right? To that extent. And then at those days, we had something called a pre-university. That was is like a class 12, right? And so that's when I retook biology. And so that's how I became a doctor. And then my story, let me share the story of how I got into AIMS. Well, I was very fortunate to get into AIMS, and the story also is weird. And so my father was in the government service, and he was posted in Delhi, right? So he was in a Union Territory cadre. So Delhi is a Union Territory, so that's how he landed up in Delhi. And so for a person in those days, where there was no social media, nothing, no Google, nothing. We had no idea about what things were. And so when I landed up in Delhi, I didn't have any books, so I thought I need to get books to study. So at those times it was this place in Old Delhi called Naisarak, right? Naisarak, you have all these medical books and all that. And so I went to Naisarak, and what did I see selling over there? There's AIMS and other medical colleges, entrance examination. That's how I learned about AIMS, right? I mean, we were so illiterate those days, so ignorant. And so I applied, and in God's grace, I got in there. And so that was my MBBS. Then how did I become a surgeon, right? So it's a long story, so let me go through that. So how did I become a surgeon? So for some reason, in those days, the choice of subjects for post-graduation was medicine and pediatrics, number one, right? So I thought I want to also become a pediatrician. So in those days, for some reason, there was this clause that and so we had to go to this entrance examination for that. So I was sitting in the entrance examination, and I thought, pediatrics to humko nahi milega because there's so much more bright people ahead of me. So let me change my topic, right? So for some reason, we had this thing where people from that same medical college could change their topics in the examination hall. So that's how I became a surgeon. We'll change my from pediatrics. And I think neurosurgery was the only subject where I actually took a definitive direction, kind of a desire. I had a desire to be that. And the reason is it's a subject which I know will never end, right? It's an ever-expanding field. It'll never end. So I wanted that. I wanted something which had a certain amount of uncertainty, what the future was, and incompleteness, so that there's always things to learn, right, to expand. That was the reason I became a neurosurgeon.
Thank you so much.
Yeah.
Thank you so much,
Okay.
sir. Thank you so much, sir, for your time, your wisdom, and the clarity with which you addressed every question. Your journey and perspective truly remind us that healer is not made in operations and theaters alone, but through commitment, compassion, and continuous learning. We are grateful for the audience. Now, I would like to invite our director, sir, once again for the felicitation of Dr. Rana Padir, sir. So please come on the stage. Let's give them a huge round of applause, everyone. I would also like to invite Mr. Srinivasan sir and Mrs. Pavna Ranganathan ma'am to please come on the stage. Let's give them a huge round of applause, everyone. Thank you everyone for joining.
ठीक है अब दिखा दो बाद में दिखा I'm really thankful for the team from Heartfest, Dr. Rana Patir, for bestowing so much here. The students have really enjoyed the session, I hope. How was it? Even though they could not probably understand the intricacies of the surgery and the MRI scans, but definitely it was inspiring and it just showed that so much is there to learn. And indeed, I would say we are so thankful to him, to the entire team for coming over here. Now, I would like to invite Mr. V. Srinivasan, Regional Coordinator from Heartfulness. He would like to say something about some initiative of Heartfulness which is going on. Welcome, sir. Please.
Very good morning. So it's truly an honor and delight to be here with all of you on this Saturday morning, and it was really wonderful to listen from the heart to Dr. Rana Pate. It was really heartwarming, his journey, and I think the insights which came through for all of us, as we went through his exposition. Many of you, I think, in this institute, I think Heartfulness shares a very deep relationship with your institution. Many of our trainers from Delhi come here often to take up programs and courses around meditation. I'm sure some of you may have attended these sessions and probably you have your own experience there. On the 21st of December this year, as you all know, last year, the United Nations General Assembly had passed a declaration, and this declaration happened on the insistence and proposal of some countries, India being a prominent one among them, Sri Lanka, etc., to nominate 21st December as a World Meditation Day. We all are familiar with June 21st being the International Day of Yoga, but last year, UNGA has declared 21st December to be the World Day of Meditation. It's a great opportunity for all of us to come together on that particular day. It's not just that day. I think every day is an opportunity for us to connect within ourselves, connect to the deepest potential within through a meditative practice. But on 21st specifically, Heartfulness is organizing a global meditation. This will be conducted virtually across the world. It's a short 45-minute session, of which there will be a 20-minute guided session of Heartfulness meditation by the facilitated by the Global Guide of Heartfulness, Daji, Sri Kamlesh D. Patel. But the beauty is, it will have almost, say, a huge cross-section of humanity, about 1 million people joining virtually from wherever they are. I mean, from their homes, their offices, at that one particular time. Now, how it feels to meditate at one moment when 1 million people are meditating is something which is very difficult for me to elaborate or explain through words, but I would suffice to say that when you meditate individually, certainly you create a ripple in the wave of peace in the entire world. But when you all come together as a unit, as one family, wherever we are across the world in thousands to meditate at one time, it creates or unleashes a certain wave of peace, love, and a shift in our own and collective consciousness. To experience this, I would really, on behalf of Heartfulness, invite each one of you. All of you have such a wonderful spirit of learning. I've been seeing the absorption level and the attentiveness with which you are listening to Dr. Pate. So please do join us on that particular day. All that you need to do for this is a 30-second process. You need to sort of, if you have your mobile phone now itself, I would encourage you, please just scan the QR code. It will give you a link to register. That registration takes about 15-20 seconds. and that will send you a WhatsApp message to you clarifying that you have registered, and that you can share with others in your friends, society, circles. And this is not just about garnering people to meditate, but when you invite and offer an opportunity of an experience of meditation to someone, it sort of leaves within his subconscious a very deep footprint, which becomes a game changer for his life. So I think this is a gift for a lifetime you can offer for yourself and for others. So welcome you all to this wonderful day and experience. Thank you so much.
Thank you, sir. Before moving further, we'll show you a scanner. It is like the feedback form for the event happened today. So I request all the registrant participants and the online participant to please fill this form.
बाद में करूँगा पहले इनको बोलने देते हैं मिस्टर एपी टोमर
डॉक्टर एपी टोमर
मिस्टर बोला है
डॉक्टर
इनको मिस्टर एपी टोमर आपकी मेडिटेशन
Thank you, sir. Now I'll move forward. I'd like to call Mr. A.P. Togo, sir, on the stage. Let's give him a huge round of applause, everyone.
Thank you. Thank you.